the whole truth about aspirin, a miracle pill or a potentially dangerous substance. Scientists have answered the main questions about the drug, which can be found in any home medicine cabinet. Years ago, scientists announced a cheap painkiller as a miracle remedy relieves pain, prevents heart disease, dilutes blood, and prevents blockage of arteries. After that, doctors immediately included aspirin in the recommendations. The drug was recommended to all people over years of age as a prevention of a heart attack. As a result, today millions of people take aspirin daily in low doses from 2 mg per day as a prevention of heart attacks and cancer development. Others take aspirin in high doses from mg per day for headaches and other pains as well as fever. About 1,000 tons of aspirin are produced annually in the world. However, today, the shining star miracle pill seems to be under threat. New studies are increasingly warning that aspirin also has quite serious side effects. With daily use, the drug can lead to the development of stomach ulcers and internal bleeding. The study showed that taking aspirin daily in small doses leads to a reduction in the risk of developing heart problems, but it also led to a corresponding increase in the risk of bleeding. Risk of bleeding. Back in, the Working Group on Disease Prevention in the United States recommended that doctors prescribe aspirin in small doses as a prevention of cancer and cardiovascular diseases. However, everything has changed, and now the Working Group on Disease Prevention in the United States believes that the risk of internal bleeding due to aspirin is higher than previously thought. As a result, people aged, too, are recommended to take aspirin daily in low doses only if they have a genetic predisposition to heart disease. At the same time, people aged and older are not recommended to take aspirin at all. At this age, it is of little use. At the same time, people taking aspirin daily are urged to be careful when getting various injuries and cuts. In addition, the Working Group on Disease Prevention in the United States warns that aspirin can cause not only internal intestinal bleeding, but also cause ulcers in the intestine, damaging the stomach and intestinal mucus. The study of Australian scientists, which was attended by almost 1,000 people aged years and older, lasted years. Researchers found that people who consumed low doses of aspirin daily had a significantly increased risk of serious injury and even death after a fall. Scientists suggest that this may be due to the anticoagulant effect of the drug. People who have fallen while taking aspirin may have severe bleeding or bruising that requires emergency care. As these people get older, the risk of cardiovascular disease increases, but the risk of bleeding also increases. It is very difficult to find a middle ground where you get more benefits than harm. In addition, scientists have found contradictions in studies suggesting that a daily dose of aspirin can reduce the risk of developing bowel cancer. In the early stages of the analysis, a decrease was indeed observed, but after years of testing, scientists found no benefit. Subscribe with a bell to always be aware of useful recommendations.